Tuberculosis (TB) is a contagious bacterial infection caused by the bacterium Mycobacterium tuberculosis. It primarily affects the lungs, but it can also affect other parts of the body such as the brain, kidneys, and spine. TB is spread through the air when an infected person coughs or sneezes, and it can also be spread by sharing contaminated items such as needles. Symptoms of TB may include persistent cough, chest pain, fatigue, fever, night sweats, and weight loss. However, some people with TB may not experience any symptoms, especially in the early stages of the infection. TB can be diagnosed through several tests, including a skin test, a blood test, a sputum test, and chest X-rays. Treatment for TB involves taking a combination of antibiotics for a period of several months. It's important to complete the full course of treatment, even if symptoms improve, to prevent the development of drug-resistant strains of the bacterium. TB is a serious public health issue, and it is one of the leading causes of death worldwide, particularly in low and middle-income countries. However, TB is curable and preventable with proper treatment and public health measures such as improved ventilation and infection control measures in healthcare settings. Vaccines, such as the BCG vaccine, can also help prevent TB, although their effectiveness varies widely depending on the strain of TB and other factors. Anti-TB regimen. Anti-TB tuberculosis regimen is a treatment plan that includes multiple medications taken over a period of several months to effectively treat TB infections. The goal of the treatment is to cure the infection, prevent the development of drug-resistant strains, and prevent the spread of the disease to others. The specific medications used in the regimen, as well as the duration of treatment, can vary depending on the individual's medical history, drug sensitivity testing, and the severity of the infection. The standard anti-TB regimen consists of two phases, the intensive phase and the continuation phase. During the intensive phase, the patient takes a combination of 4 medications: rifampicin, isoniazid, pyrazinamide, and ethambutol daily for a period of 2 months. These medications work together to rapidly kill the bacteria and reduce the risk of developing drug resistance. After the intensive phase, the continuation phase begins. During this phase, the patient takes 2 medications, rifampicin and isoniazid, for a period of 4 to 7 months, depending on the severity of the infection. These medications are taken daily or intermittently twice weekly under medical supervision. The specific dosages of each medication and the duration of treatment may vary depending on factors such as the patient's weight, age, liver and kidney function, and any other medical conditions they may have. It is important for patients to take their medications exactly as prescribed by their healthcare provider, even if they start feeling better before the completion of the treatment. Skipping doses or stopping the treatment early can lead to the development of drug-resistant strains and recurrence of the infection. Patients may experience side effects such as nausea, vomiting, skin rash, or liver toxicity while taking the medications. These side effects can usually be managed with medical supervision and support. In some cases, patients may require an alternative regimen if they are unable to tolerate or are resistant to one or more of the medications in the standard regimen. This requires drug sensitivity testing and consultation with a TB specialist. Overall, adherence to the anti-TB regimen is crucial for the successful treatment of TB infections and to prevent the spread of the disease to others. Anti-TB drugs. There are several drugs that are commonly used in anti-TB regimens. Each of these drugs works in a different way to target different aspects of the tuberculosis bacterium. Here is a brief explanation of each anti-TB drug. Isoniazid Isoniazid is a bactericidal drug that kills the actively dividing bacteria by disrupting their cell wall synthesis. It is the most important drug in the anti-TB regimen, and is used in both the intensive and continuation phases. Isoniazid is generally well tolerated, but it can cause liver toxicity and peripheral neuropathy, nerve damage, in some people. Rifampicin is a bactericidal drug that works by inhibiting bacterial RNA synthesis. It is also a key drug in the anti-TB regimen, and is used in both the intensive and continuation phases. Rifampicin is generally well tolerated, but it can cause liver toxicity, rash, and flu-like symptoms in some people. Pyrazinamide Pyrazinamide is a bactericidal drug that works by disrupting bacterial metabolism. It is used only in the intensive phase of the anti-TB regimen, and is not typically used in the continuation phase. Pyrazinamide can cause liver toxicity and joint pain in some people. Ethambutol Ethambutol is a bacteriostatic drug that inhibits bacterial cell wall synthesis. It is used in the intensive phase of the anti-TB regimen, and may also be used in the continuation phase for patients with drug-resistant TB. Ethambutol can cause optic neuritis, inflammation of the optic nerve, and vision problems in some people. Streptomycin SM. Streptomycin is an aminoglycoside antibiotic that is used in the intensive phase of the anti-TB regimen. It works by inhibiting bacterial protein synthesis. Streptomycin can cause hearing loss and kidney damage in some people. Rifabutin RBT. Rifabutin is a rifamycin antibiotic that is sometimes used as an alternative to rifampicin in patients who cannot tolerate rifampicin or who are taking medications that interact with rifampicin. Rifabutin has similar side effects to rifampicin, but is generally better tolerated. Bedaquiline BDQ. Bedaquiline is a newer drug that is used to treat multidrug-resistant TB. It works by inhibiting bacterial ATP synthesis. Bedaquiline is generally well tolerated, but it can cause heart rhythm disturbances in some people. Delamanid DLM. Delamanid is another newer drug that is used to treat multidrug-resistant TB. It works by inhibiting bacterial cell wall synthesis. Delamanid is generally well tolerated, but it can cause nausea and liver toxicity in some people. It's important to note that the specific drugs and dosages used in the anti-TB regimen may vary depending on the patient's medical history, drug sensitivity testing, and the severity of the infection.